Top 10 reasons you should see a board-certified cardiologist. Remember, I just said board-certified cardiologist, and you make that choice with your doctor. I'm Dr. Evan Levine, board-certified cardiologist. If you enjoy my videos, please like, share, and follow. Number one, chest pressure. Again, it's really not chest pain, but most cardiac diseases, the chest pressure, usually like a stack of books pushing on your chest. And as you walk, it becomes worse, and you rest, it gets better. Sure, people have chest pain, but more so chest pressure. Number two, high blood pressure, although a good internist is likely fine as long as your blood pressure remains well controlled. But if it's well above the 120/80, or if you feel you're on too complicated of a drug regimen, well, almost all my patients, for example, take once-a-day meds, and I go for 120/80. So if you're unhappy, see the cardiologist. Number three, family history, especially first-degree relatives, mother, father, sister, brother, son, daughter, of special diseases, I'm going to call this, like a bicuspid aortic valve, hypertrophic cardiomyopathy, or sudden unexplained cardiac death from an arrhythmia, especially in a young person. You want to see a cardiologist. Number four, if you have shortness of breath when you walk. Now, this could be anything from a blocked artery. Not everyone gets that chest pressure. You see? Especially women. So you may have structural heart disease or some sort of heart failure or problem with a valve that your doctor missed, and you're having chest discomfort and shortness of breath, just shortness of breath. Number five, you have diabetes, but be aware that most diabetics without symptoms do not require stress tests. That's right. There have been studies showing that asymptomatic diabetics don't feel better if they're getting stress tests. So if the heart doc tells you need one and you're having no symptoms at all, question that or move on. And when I see a diabetic, very few of these patients get stress tests because I'm honest. And I look at their risk factors, get their blood pressure and cholesterol better, and maybe consider a coronary artery calcium score. But no automatic stress tests. Doctors, no automatic stress test. Number six, you have high cholesterol. Now, many doctors just don't understand all the current recommendations and guidelines on how to calculate the relative risk based upon your cholesterol. Also, adding special tests like ApoB, lipoprotein a, only do that once, and high sensitivity CRP can help. And I've seen patients who should not be taking statins taking them, others who should be on statins that are not on them, and several on just too low a dose of statin when they should be on really high aggressive doses or other alternatives like the injectable medications that you know as Praluent and Repatha. Number seven, you have a murmur and your doctor wants you to have an echo, or maybe an echo in their office with a portable echo company. And for me, that's a no-no. Ask for referral for the echo at the cardiologist, or even better, at a university hospital, even if they say they have a heart doctor reading their echoes from the portable echo. You see, you can get a poor quality study and things can be missed. Number eight, you have a strong family history of heart attacks. Now, certain types of heart disease, I say, can be genetic, and it's very important, especially if you have a family history of people with heart attacks under the age of 55 in men and 65 in women, and the cardiologist can help determine other risks that you may not be aware of, and then consider other comprehensive testing, like I just mentioned, including the lipids and the coronary artery calcium score. Remember, usually stress tests are not indicated, patients and cardiologists. Number nine, you have other artery disease. This is important, like blockages in your legs, or you're told you have an aortic aneurysm, or a blockage in the carotid artery, or a CAT scan that found calcification of the coronary arteries, a CAT scan of the chest just by coincidence, or even a mammogram, ladies, that notes breast arterial calcification. That's right. Circulation 2022 showed these women had a much higher risk of heart events, and in those patients, they should see a cardiologist. Number 10, you're inactive and you're planning to start an exercise routine. Listen up. Now, most people, guess what, do not need a stress test prior. Most. Without any data, doctors were doing this for years. The key here is to start slow. Never allow a trainer to bring you to exhaustion just during the first couple of weeks. You want to build up slowly. And of course, if you have symptoms before you start this, or if you have any symptoms as you begin, and exercise program, it's time to see a board-certified cardiologist. I hope that helps.